All right, welcome back. He came from humble beginnings in the midst of poverty and violence. However, he did not let that determine his path. Resident doctor at Kings County Hospital in Brooklyn, New York, Dr. Shemar Rhoden zooms in now to share his story. Good morning to you, sir.
Good morning. Good morning.
Dr. Rhoden, you grew up on Studio One Boulevard, right? Now the question
That is
is, why not music?
You know, Studio One Boulevard wasn't by choice. It's where the parents grew up. So I'm very proud of it, specifically Heathrow Road. So big up Heathrow Road. That's where I'm specifically from, off Studio One Boulevard. If music did choose me, I definitely would have chosen music. But, I'm not that musically inclined.
Hey, that's fine as well. I mean, because you kind of figured out what worked for you. So early environment, how did that shape your decision now to pursue something in medicine?
Funny enough, like medicine wasn't the first choice. As a kid, I wanted to be a pilot, but I think my tumultuous journey during childhood, spending a lot of time in the hospital, kind of shaped me to wanting to do a career in the healthcare field. I didn't know what exactly. I think dentistry kind of came later down the line from me witnessing early in Jamaica that a lot of people didn't get access to dentistry, even though my family was privileged enough to be able to attend one or a few times while we were living in Jamaica, but people in the community didn't really have that access. Yeah. So I came to the US. It was kind of still in the back of my head, not really thinking I could ever achieve that because I never really see people like me being a dentist. So I think it later came down once I was in college and I locked in that this is a true possibility. Like I could really achieve something like this.
Yeah. What do you like most about being a dentist?
So dentistry, in the field of medicine, it's creativity. It's a philosophical idea, and it kind of combines medicine with artistry, and the interpersonal skills that you share when you meet your patients is second to none. And that's one of the reasons why I wanted to kind of go into it. Even though, a lot of times people fear going to the dentist because we tend to be seen as the pain doctors. But for me, I try to change that vision with my own patients and trying to be more of a friendly, welcoming environment.
Yeah, and there has been so much evolution, in this field that no longer do you go in expecting a lot of pain. In fact, as you rightly said, the creativity is there and the innovation is there, so much so that people walk out now with less pain.
Mm-hmm. Yeah, that's true. So as technology progresses in the field and being a new grad coming out of the field, we've been trained on a lot of the new technologies in terms of pain management and overall patient experience. I think that's a big thing because we want to maintain a sense of, trust in the community. We don't want to be the guys being told that, we don't want to go see them doctor because the doctor caused with pain. I never had the pain before I went, It's trying to change the narrative around dentistry.
Yeah, absolutely. I know you mentioned, going inside the hospitals that kind of influenced your path. But did you have any key mentors, any influencers, over your life that made you decide to choose this particular path?
Specifically in dentistry, I think it kind of flourished from growing up. As I said, like going to the dentist, seeing my family being one of the few people doing it. Then when I went to college, there were a few friends that I would say we kind of all clicked off that we were all pre-med, pre-dental people. And it was mostly during that time I started to like network with like clubs at my undergrad, Brandeis University. And we are able to start visiting different colleges just to get introduced to different fields and careers in medicine. And I think that was more of the true passion kind of stemmed from there because I started to visit those schools and I kind of started to see myself in the space that I never was doing before. And during that time, of course, I would start reaching out to different dentists in the area, trying to shadow, trying to get a little bit more exposure and so on and so forth.
Yeah. I want to ask you a question, right? Two parts. So what has been the most rewarding part of this journey for you and the most challenging part?
The most rewarding part is getting rid of all the challenges that came with it. It's been stressful. So I'll start by saying the most challenging part was a lot of times whenever you're doing anything in higher academia standards, it takes a lot of sacrifices. So you have to sacrifice your personal time, your social all of those things go through the window because you kind of have to program yourself to believe that the only thing, kind of like tunnel vision in on this goal with no distractions. And because of that, sometimes you may miss out on like what's going on within those 8 years while you're in school with family events and so on and so forth, losing a lot of friendships because you kind of have to stay in and study all the time. And I would say one of the most rewarding part now is being able to fully kind of get back into that self where I'm being able to rekindle with family and, hang out more and have free time to myself to kind of go and explore things that I've always had an interest in.
Yeah. Have you become the family dentist now? Are you the go-to person everybody calls when they're having a little toothache or something?
I've been a family dentist, so even before I was a dentist, they were asking me questions that I didn't have the answer to. But I'm glad to be able to represent them in this way and make them proud. I'm happy to be the family dentist, and I'm hopefully my goal is to inspire people beyond me, younger generations, people in my year to be more dentists. So hopefully it's going to be a new family of dentists, or even like introducing other family members to become doctors, nurses, whatever they want. My goal is just to inspire anyone that has a passion.
Absolutely. Doc, I want to ask you this. We may not understand all the terms that you're about to use, but I want to ask you about the most complex case that you've worked on to date. Tell us about it.
Well, I worked on a few complex cases, but I would say as a student doc right now, graduating, I'm a general dentist, meaning I do everything from the realms of complex extractions, surgery to denture cases. And I think one of the more complex aspect of dentistry is not just the work itself, because the technical skills will come. I think it's the more challenging part is dealing and motivating patients to take their whole health into consideration. So there's just one patient that was edentulous, meaning the patient had no teeth for years, and he comes sit in my chair, and I'm trying to convince him, you need to get some dentures, man, because this look, no teeth, is not doing it anymore. And it took me months to try to convince this brother, like, he needs to get the dentures, because to me, whatever I was telling him was nonsense, and he didn't want to hear it. So I think one of the most challenging part is trying to learn ways on how I could really interact with patients to kind of motivate them beyond this.
Yeah. I want to ask you about the new and the most popular thing right now, the veneers, right? Everybody's putting them in. Let's talk about it. Give us the facts about it.
So yeah, veneers are like one option of dentistry in the restorative sense. Initially, veneers were started as an aesthetic option for people who, want a little bit brighter of a smile. So it's kind of like putting fake nails on your teeth. So there's options to do it where you don't have to prep the tooth at all, meaning you don't have to shave the tooth. Your dentist will just go and stick on this veneer. Or there's other options where you kind of have to shape down the tooth just a tiny bit to create the space for the veneer. Regardless, the option, these are all verbal options on the table for patients who want to get a brighter smile or a straighter smile. There's other options, not just going straight to veneers, to try to do orthodontic work, to make sure you're treating the smile, make sure the teeth are pretty straight before you're trying to do something like that. But I know it's been popular in the media. Everybody wants veneers right now because it's not the new hip thing. But I always advise patients, to look at all the options and not just run to one thing because it's the new hip thing, or even advise counterparts, my dental counterparts. And I always try to sell patients veneers right out the back because it's the most lucrative thing, right? So it's just trying to do it ethically.
Well, listen, thank you so much for your time, sir. And congratulations on everything that you have achieved so far. Do you want to say hello to anybody who's watching this morning?
Yeah. I want to, say thank you to my family, everyone that's been on the journey so far. The community which I come from, I want to go once ahead and big up them because, I never be afraid of where you come from, because the community you come from might be the place where you develop all the strengths to carry you through. The journey hasn't been easy, but I want to leave with saying to everyone, or any pre-dental student, any pre-medical student currently growing up in Jamaica, is stay locked in. It doesn't matter where you start. It doesn't matter what community you're coming from or what people tell you, because I grew up being told before that, I was a dunce because I was slower. I used to spend a lot of time in the hospital as a sick child, missing school. And because of that, I was much slower in school. So it doesn't matter what people say when it comes in regards to that. If you have a dream, just stick to it. It's going to be hard, but always remember what the end goal is and where you're coming from, so you're never going backwards. And that's what I want.
Very well said, Doc. Very, very well said. Thank you so much for your time. Congratulations again, all right? Thanks for joining us.
Thank you.
Resident doctor at Kings County Hospital in Brooklyn, New York, Dr. Shemar Rhoden. Still to come, it's all about the Get Justice series. But first, the second edition of News in 5. Stay with us.